Hello everyone, my name is Bridget Lowry and I chose carbamazepine as my drug to research. Carbamazepine is widely known to treat certain types of seizures. However, it's also used to treat bipolar disorder, which is what I chose to analyze and become more knowledgeable about. Carbamazepine's trade names include Tregadol, Tregadol XR, and Epidol, while the classification of carbamazepine falls under the class of anticonvulsants, therefore have been approved by the FDA to treat many medical conditions such as bipolar disorder. And the picture I have shown below actually just represents the composition of carbamazepine. To start things off, I would like to begin with an overview of what bipolar disorder is and what it consists of. So for those who are unaware, bipolar disorder, or also known as manic depression, is defined as a mental health condition that causes extreme mood swings. These mood swings include emotional highs and lows. Furthermore, bipolar disorder typically begins in adolescence or early adulthood, having lifelong effects on someone's mental and physical health. Even so, having effects on someone's education, occupation, and interpersonal relationships. For example, sleep, energy, activity, judgment, behavior, and the ability to think are all key pieces being affected when obtaining bipolar disorder. Continuing on, there are several types of bipolar and related disorders, including bipolar 1 and 2, cyclothymic disorder, and other types that are induced by certain drugs due to specific medical conditions. Great examples of this are Cushing's disease, sclerosis, or even just a stroke. However, the most common types of bipolar disorder are bipolar 1 and 2. Below, I have actually inserted a picture to show the different mixed emotions someone with bipolar disorder might have, and I will go more into detail about each type of emotion in later slides. A formal diagnosis of bipolar disorder may require a consultation with an experienced primary care physician, psychiatrist, psychologist, or APN to confirm certain criteria within bipolar disorder. A clinical interview represents an important element in treatment planning, helping identify the right medication and treatment, presence of past or current episodes, duration and severity of episodes, impact of mood swings, presence of commodities, history of treatments, and family history are all indications to look for when diagnosing bipolar disorder. Physical examinations and laboratory tests are also used to exclude other disorders like hypothyroidism and hyperthyroidism. It's also very helpful to ask family members or close friends to provide descriptions of the symptoms their family member is experiencing. There are multiple other symptoms to look for when diagnosing bipolar disorder. These include mania, depression, psychosis, melancholy, or anxious distress. When moods shift to mania or hypomania, it's likely to feel euphoric, full of energy, and unusually irritable. When depression sets in, the feeling of sadness or hopelessness occurs, making someone become less interested in daily normal activities. With psychosis, someone will lose contact with reality, experiencing hallucinations and delusions. For example, someone might hear voices or have strong beliefs about a conspiracy hurting them. The combination of hallucinations and delusional thinking can cause severe distress and major changes in behavior. Furthermore, melancholy is a gloomy state of mind, being yet another form of sadness someone could be experiencing. The difference between depression and melancholy is that depression is a prolonged feeling of sadness, but melancholy has a distinct quality of mood that can be interpreted. Lastly, anxious distress is another symptom/indication to look for when diagnosing bipolar disorder. With this, someone will feel unusually restless or tense, and the timing of these symptoms may occur during pregnancy or during different seasons. Symptoms in adults and children can differ with bipolar disorder. For instance, children are difficult to diagnose because it's hard to tell whether ups and downs are from stress, trauma, or just signs of a mental health problem. Children and teens may have distinct major depressive or manic episodes, but the pattern can vary from that of adults with bipolar disorder. Moods can rapidly shift during episodes, and they may experience periods without mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. Some symptoms in children include grandiosity, overconfidence, confusion, and inattention. The picture I have shown, provided to the right, is a clear representation of how one's brain looks with all of the effects bipolar disorder causes. Like I've previously mentioned before, there are several types of bipolar disorders, all differing in their own distinct way. The first one is bipolar 1, which includes at least one manic episode that could be followed by one hypomanic or major depressive episode. Abnormal behavior during manic episodes includes flying from one idea to the next, rapid and loud speech, increased energy yet decreased sleep, inflated self-image, excessive spending, hypersexuality, and substance abuse. An episode can last anywhere from a few days to several months, and symptoms continue for a few weeks to a few months. The next bipolar disorder I would like to pinpoint is bipolar 2. In order to diagnose someone with bipolar 2, a person must have experienced at least one major depressive episode and at least one hypomanic episode, but never a manic episode. Bipolar 2 can cause someone to feel euphoric or irritable while exhibiting abnormal behaviors. Symptoms include a decreased need for sleep, rapid and loud speech, excessive spending, inflated self-image, and unrealistic planning. When comparing the different types of bipolar disorders, it's apparent that each disorder has their very own type of episode implanted in them. Not only this, but symptoms can differ as well, making each disorder have its own individuality for diagnosis. The last disorder I want to analyze within all of the different types of bipolar disorders is cyclothymic disorder. With this type of disorder, many periods of hypomania symptoms and periods of depressive symptoms occur. People with cyclothymia experience cyclic high and lows as portrayed by large mood swings and energy levels that negatively affect their ability to function. Due to these highs and lows, symptoms include high levels of self-esteem, being talkative, having racing thoughts, being distracted easily, focusing more on goals, feeling of being rested, increased agitation, and overly involved in risky activities. Symptoms must cause significant distress or impairment in daily functioning, but cannot be severe enough to meet criteria for either major depressive disorder or bipolar disorder. To determine if someone has bipolar disorder, evaluations can include a variety of different things. As mentioned before, physical exams and lab tests can be used to diagnose someone with bipolar disorder. Using these methods can help identify any medical problems that could possibly be causing symptoms. Another way for diagnosis is a psychiatric assessment, often being referred to by doctors. This assessment will help increase the communication about feelings and behavior patterns. Also, within this assessment, psychiatrists may have patients fill out a self-assessment, including various types of questions about episodes, patterns, history of treatments, and adherence to medications. Family and friends are also a huge help within this assessment to provide different information about symptoms and experiences they've had with the situation as well. The last and final way to diagnose bipolar disorder is with a mood chart. This is more personal to the patient due to the doctor asking them to keep a daily record of their moods, sleep patterns, and other factors that may be affecting them in any way, shape, or form. Follow-up methods and testing are often used with bipolar disorder to help regulate symptoms and alleviate any problems that could be occurring. One test that could be used to identify the severity of symptoms is the Young Mania Rating Scale. This scale measures manic symptoms in order to realize the severity of such episodes. This test includes 11 items with a score between 0 to 60. Another follow-up test is the Scale for the Assessment of Positive Symptoms. This is a clinician-administered scale to measure the severity of psychotic symptoms, with 35 items in 5 sections. Some scales or assessments have different indications they measure, which is actually incredible to give people the help they truly need. These follow-up tests go into more depth than questionnaires and family communication. Nextly, the Clinical Global Impression rates the patient's function by clinician and shows a general picture of the current state of mind. With this, it includes 3 items, being the severity of the illness, global improvement, and the efficiency index. Nonetheless, global assessment of functioning measures the psychological function of patients with psychiatric disorders. This test can have a score that ranges anywhere from 0 to 100. Continuing on, the Drug Attitude Inventory is a self-report inventory to rate the attitude of patients toward prescribed medications and the effects of this attitude on adherence to the medications. Finally, the last follow-up test I wanted to examine was the family interview for genetic studies. This is an interview with family to determine psychiatric disorders. The interview includes general screening questions and a few checklists, such as the depression checklist and the mania checklist. Another important factor I would like to share is that psychiatrists, in order to determine a diagnosis, may compare symptoms to the Diagnostic and Statistical Manual. The picture on the right is an example of what this manual may look like, with different sets of criteria to meet. Using this manual helps assess the patterns of symptoms and how impaired the person is after having severe episodes. Treatment is best guided by someone who is skilled in treating bipolar and related disorders, such as a psychiatrist. Treatment teams can also include a psychologist, a social worker, and a psychiatric nurse. Treatment is directed at managing symptoms and varies with each patient depending on their needs. Psychotherapy is a vital part of bipolar disorder treatment and can be provided in individual, family, or group settings. There are many types of psychotherapy, and the first one is interpersonal and social rhythm therapy. The IPRST focuses on the stabilization of daily rhythms, such as sleeping, walking, and mealtimes. A consistent routine allows for better mood management, and people with bipolar disorder would benefit from establishing a daily routine. Another treatment within psychotherapy is cognitive behavioral therapy. The focus within this treatment is identifying unhealthy beliefs and behaviors and replacing them with healthy, positive ones. CBT helps identify triggering of episodes and helps the patient learn effective strategies in managing stress. Psychoeducation is yet another treatment that focuses on the education behind bipolar disorder. If the patient or family members know the background of bipolar disorder, it helps with the understanding of conditions. Knowing what's going on helps increase support, identifying issues, and making plans to prevent relapse. Finally, family-focused therapy is the last treatment psychotherapy has to offer. This helps obtain family support, communication, and sticking to the treatment plan. This is very effective because it can help family and other loved ones realize and recognize and manage warning signs for symptoms. Depending on your needs as an individual, other treatment options can also be added to your plan and journey of living a happy, healthy life. Self-management strategies are a great way to receive treatment, focusing primarily on education and recognition of an episode's early symptoms. Complementary health approaches provide support, not treatment. These include aerobic exercises, faith, and prayer. Another treatment is day treatment programs. Doctors may recommend a program like this that provides the support and counseling someone might need while symptoms are being controlled. Lastly, hospitalization is always a last option if behavior becomes dangerous or out of control. For example, being suicidal or detaching from reality is a sign of hospitalization. Getting psychiatric treatment at a hospital can help someone calm and be safe while stabilizing moods. Medication is also a form of treatment within bipolar disorder. A number of medications are used to treat bipolar disorder and vary based on particular symptoms. Finding the right medication for someone is like trial and error because it takes time and patience to find what will work perfectly. Mood stabilizers control manic or hypomanic episodes, having a variety of different medications to take. And as you can see, I have listed some examples just to get an idea of what those will include. Moving on, antipsychotics help with depression or mania in spite of treatment with other medications, and again, I have listed some examples of those. Accordingly, antidepressants help manage depression, but it sometimes can trigger a manic episode, and as a result of this, antidepressants are often prescribed with a mood stabilizer or antipsychotic, and again, I have listed some of examples of those. Continuing on, antidepressant antipsychotic is another form of an antidepressant combining all of the examples I have listed, like Simbax, fluoxetine, and olanzapine. And to conclude, anti-anxiety medications include the examples that I have listed below. Now we are going to look at whether the drug I chose is considered to be the best choice of medication. It's apparent with bipolar disorder that everyone responds to medication differently. Finding the right drug and dose can be tricky, making it very difficult to find the right medication. As I've explained in previous slides, there are other ways to treat bipolar disorder other than using medication. Medication is used to reduce symptoms, and certain medications and have different benefits than others. Lithium, however, has become the most well-known medication for bipolar disorder and is an essential tool for stabilizing someone. This doesn't make carbamazepine any less than lithium. It's just that lithium has had more benefits and a better reputation. Carbamazepine is actually the next best thing when patients don't respond well to lithium. Lithium is the oldest and most well-known mood stabilizer and is highly effective for treating mania and bipolar disorder. It's the only true mood-stabilizing medication that remains the best established for long-term treatment. Lithium was the first compound approved by the FDA for the treatment of bipolar disorder. Lithium is also approved for use in bipolar mania and bipolar maintenance treatment. Lithium, unlike many other medications, have many different beneficial effects. It reduces the risk of suicide by 80% and lowers the risk of cancer, heart disease, strokes, and viral illnesses. Lithium is still the first choice mood-stabilizing drug in many circumstances, but blood levels must be consistently monitored to ensure that lithium level is high enough to be effective, but not high enough to be toxic. Going back on the subject of different medications having different effects, I have included a few other medications that are also used to minimize symptoms within bipolar disorder. Quetiapine is the first example that clearly covers ground that lithium doesn't. It's more effective against mixed manias. Lithium is used for euphoric highs. The medical benefits within lithium is unmatched. However, it does assist with anxiety and insomnia. Valproic acid is another medication to analyze that has different benefits compared to other medications. It has been approved for treatment with bipolar mania and is a mood-stabilizing agent combined with lithium. It's known for being the first choice for rapid cycling, mixed mania, or mania with hallucinations. Side effects using valproic acid include drowsiness, weight gain, dizziness, and diarrhea. In conclusion, lamotrigine has fewer effects than lithium and valproic acid. It's approved in the maintenance treatment of bipolar disorder while preventing depression. It has been said that lamotrigine works better when a patient has bipolar 2, and some experts favor it for the rapid mood fluctuations of cyclothymic disorder. The main risk of lamotrigine is during the first 3 months of treatment when Stevens-Jones syndrome and other life-threatening allergic reactions can occur. There are many other medications physicians use to treat bipolar disorder, but these were the ones that have become well known. Carbamazepine may not be the most well-known or oldest mood stabilizer to treat bipolar disorder, but like I've said, each medication is prescribed with everyone's own needs. For some, lithium may or may not work. That is why there is a huge number of medications that can also be given to treat individuals' needs. Moving on to normal physiology, here is just a brief overview of what normal physiology is. Normal physiology is the study of how the human body works. It mainly describes the chemistry and physics behind basic body functions, from how molecules behave in cells to how systems of organs work. Nonetheless, physiology revolves around understanding how the human body maintains a steady state while adapting to outside conditions, a process well known as homeostasis. This helps us better understand what happens in a healthy body in everyday life and what goes wrong when someone gets sick. Emotion within bipolar disorder is characterized by the dysregulation in the dopamine and serotonin systems and by pathology in the brain systems involved in regulating emotion. This regulation of emotion consists of manic and depressive episodes. Recurrences of mania or depression are a result of the mutual influential interactions between genes, neural pathways, and socio-environmental influences. Psychosocial stressors, notably life events and familial expressed emotion, significantly influence the course of the illness in the context of these vulnerabilities as well. In order to understand emotion, it's significant to understand what parts of the brains control certain emotions. The brain is a very complex organ that plays a huge role in how someone will control or process their emotions. Emotions come from the limbic system, which is a group of interconnected structures located deep within the brain. It's a part of the brain that's responsible for behavioral and emotional responses. The structures listed below have been accepted to be structures that make up the limbic system. First, the hypothalamus is involved in sexual responses, hormone release, and regulating body temperature. Second, The hippocampus helps preserve and retrieve memories. It also plays a role in how to understand the spatial dimensions of the environment. Next is the amygdala, which helps coordinate responses to things in your environment, especially those that trigger an emotional response. The amygdala plays an important role in fear and anger. Lastly is the limbic cortex. This part contains two structures, the cingulate gyrus and the parahippocampal gyrus. They both impact mood, motivation, and judgment. To show where these structures are located, I have inserted a picture to give a better understanding. Now, moving forward with brain circuits, DA systems, and CA3 hippocampal neurons. Brain circuits are a set of interconnected components that together subserve a specific function. A neural circuit may comprise a network of interconnected brain regions that together integrate vast amounts of information and perform more complicated cognitive and regulatory functions. Brain circuits link peripheral brain to negative emotion, and they contribute to aversive states like fear or anxiety, and convey peripheral signals to make cognitive decisions on corresponding adaptive responses. On the other hand, DA systems include the mesolimbic and mesocortical pathways. It is known that DA is involved in the neurobiology and symptoms of a myriad of neurological and psychiatric diseases. It modulates neural regions involved in emotional learning, perception, and memory formation. Dopamine is an essential element in the brain reward system, meaning that it responds to rewards, and it is largely to create feelings of pleasure. However, if dopamine is released at a low level, it creates feelings of reduced motivation and decreased enthusiasm. Lastly, the CA3 hippocampal neurons receive information for the entorhinal cortex, excuse me if I said that wrong. These neurons are using emotional information in order to discriminate similar experiences and are capable of resolving emotional interference irrespective of stimulus similarity level. These neurons also selectively exhibit emotional modulation when attempting to differentiate interfering information. Homeostasis is the condition in which a system, such as the human body, is maintained in a more or less steady. It is a job of cells, tissues, organs, and organ systems throughout the body to maintain different variables. Maintaining this homeostasis requires at least 4 interacting components, all being a part of the negative feedback loop. The stimulus is provided by the variable being regulated. Generally, the stimulus indicates that the value of the variable has moved away from the set point or has left the normal range. The sensor monitors the values of the variable and sends data on it to the control center. The control center matches the data with normal values. If the value is not at the set point or is outside of the normal range, the control center sends a signal to the effector. The effector is an organ, gland, muscle, or other structure that acts on the signal from the control center to move the variable back towards the set point. Emotions are complex programs of actions triggered by the presence of certain stimuli. Feelings of emotion, on the other hand, are perceptions of the emotional action programs. The triggering systems, the neural systems which execute the action program, and the actions whose ensemble constitutes each emotion were selected over evolutionary time and become available to each organism of a given species. Current research indicates that emotions and feelings of emotions are distinct aspects of a functional sequence that begins when an object or situation triggers a specific behavior. They are best seen as older forms of reason, assembled by biological evolution and not by conscious deliberation. The range of emotions is wide, including fear, disgust, sadness, joy, anger, and surprise, as well as enthusiasm or discouragement, known as the background emotions. The triggering of each emotion requires the presence of an appropriate stimulus, an emotional competent stimulus, which initiates the execution of the actions in the program. The execution of each emotion is quickly followed by the respective feeling state provided. Continuing on with the basis of emotion, the execution of each emotion is quickly followed by the respective feeling state provided. Nonetheless, fear relative to external circumstances is triggered by the amygdalae, which are 2 sets of subcortical nuclei located in the depth of each temporal lobe. When those signals have a suitable configuration, an appropriate context, and reach a workable threshold, they are emotionally competent and activate nuclei in the sector of the brainstem known as the periaqueductal gray. When the situation is best handled by a flat response, the emotional state ensures that sources of energy are available in the bloodstream and adjust cardiac and respiratory functions so they meet metabolic needs. Going back to certain emotions, disgust is triggered from a small region of the anterior insular cortex when certain stimuli are present. Compassion is yet another emotion whose trigger region has been identified. The triggering site is located in the ventral and medial sector of the prefrontal cortex. The exact cause of bipolar disorder is unknown. Experts believe that there are a number of factors that work together to make a person more likely to develop it. These are thought to be a complex mix of physical, environmental, and social factors. Bipolar disorder is widely believed to be the result of chemical imbalances in the brain, genetics, and certain stressful triggers. Bipolar disorder can also be triggered by physical illnesses, sleep disturbances, and overwhelming problems in everyday life, such as money, work, or relationships. The clinical picture of bipolar disorder involves disruption of behavior, circadian rhythms, and neuroendocrine and biochemical regulation within the brain. The dysregulation of circadian rhythm includes changes in melatonin and in the expression of melatonin receptors in the CNS. Not only this, but the imbalance in the levels of one or more neurotransmitters is also a mechanism that fails within bipolar disorder. The brain also functions abnormally. Atrophy of the CA3 hippocampal neurons also occurs upon exposure to high levels of glucocorticoids, and the deficiency of DA systems stands out as a prime candidate for involvement in the pathophysiology of depression. All of these mechanisms fail with bipolar disorder occurring. Moving along, it's important to know how these failed mechanisms cause bipolar disorder. Circadian disruption, and also known as eveningness, being more active during the evening, have been associated with mood episodes, functional impairment, poor quality of life, and treatment resistance. Circadian disturbance also impacts the cardiovascular and metabolic systems while being independently associated with increased lipid peroxidation in bipolar disorder patients. Neurotransmitters are chemical messengers who transmit information from our nerve cells to our muscles, organs, or other nerve cells. They play a key role in relaying information around our bodies, regulating our behavior, and modulating our moods. The levels of neurotransmitters in our bodies are constantly going up and down. This is natural, but if the levels of a certain key neurotransmitter become too low or too high, the resulting imbalance can affect a range of bodily processes. These include moodiness, an increase in anxiety, depression, and an effect of sleep and memory. Continuing to talk about how certain mechanisms cause bipolar disorder, another one talked about before are brain circuits. If these brain circuits become abnormal, gray matter in the brain reduces in frontal regions and leads to behavioral hypoactivity, also known as depression. As mentioned before, deficiency of DA systems also becomes a huge part in what's being affected if someone obtains bipolar disorder. Overall, deficiency of these DA systems causes depression, leading to a loss of motivation. Lastly, atrophy of the CA3 hippocampal neurons lowers the threshold for cellular death, diminishes energy production, and augments susceptibility to conditions. The blood of bipolar patients is toxic to brain cells and affects the connectivity ability of neurons. In other words, cellular damage occurs. Effects of cellular damage include stress responses and calcium signaling. The calcium ions have been shown to modulate neuronal excitability, neurotransmitter synthesis/response, synaptogenesis plasticity, and apoptosis. Excitatory GABA signaling causes excess calcium and apoptosis known as excitotoxicity. Excitotoxicity destroys neurons involved in the regulation of emotion. The exasperated or prolonged activation of glutamate receptors starts as a cascade of neurotoxicity that ultimately leads to the loss of neuronal function and cell death. The mitochondria and endoplasmic reticula work together to maintain a delicate balance of intracellular calcium ions. Oxidative and hormonal stress stimulate ER to mitochondria calcium ions transferring, causing the ER to activate the UPR, restoring homeostasis. The UPR, also known as the unfolded protein response, is a signaling mechanism activated by misfolded protein accumulation in the endoplasmic reticulum. On a cellular level, communication between neurons, glial cells, and astrocytes act to regulate homeostasis. Carbamazepine has been used as AEDs since 1965 and is most effective against partial seizures. Many basic mechanisms of action have been proposed. Carbamazepine is considered to work in 3 ways. One is by blocking inactive neuronal sodium channels, preventing the generation of an action potential and depolarization of the cell. 2 is by acting as an agonist at the GABA receptor, allowing the entry of chloride into the cell and preventing the generation of an action potential. 3 is by increasing at neuronal synapses the concentration of serotonin, an inhibitory neurotransmitter. The classification of carbamazepine has many different components. Firstly, carbamazepine is a GABA agonist, also known as an inhibitory neurotransmitter. The drug stimulates activation of the GABA receptor, producing a sedative effect. It may also cause other outcomes such as anxiolytic and muscle relaxant effects. Not only this, but it also increases extracellular levels of serotonin. Carbamazepine is also known to act as a specific antagonist, being a voltage-gated sodium channel in axons that reduces neuronal excitability. Lastly, the drug carbamazepine is also a very powerful inhibitor affecting the muscarinic and nicotinic acetylcholine receptors, NMDA receptors, and the CNS adenosine receptors. The picture to the right shows these mechanisms and how they work together. The effects of binding diminish sensitivity, causing convulsion, toxicity of the CNS, and allowing broad binding to occur at remedial medications. Since carbamazepine binds to the inactivated sodium channels, it slows renewal and activation. It also detains calcium entry into synaptic membranes and depresses synaptic function, and potentiation is reduced only in supertherapeutic levels. Carbamazepine also obstructs catecholamine uptake at high concentrations. As it is chemically connected to the tricyclic antidepressants, it inhibits biogenic amine reuptake. Trailing back to the mechanism of action, it causes signs and symptoms of bipolar disorder. It works by restoring the normal balance of nerve activity and reducing the spread of seizure activity in the brain and restoring the normal balance of nerve activity. It also reduces the excitability of nerve cells, also known as relieving nerve pain. Lastly, the activation of inhibitory GABA signaling reduces mood swings. Concluding this presentation on bipolar disorder, I want to recap on a few important details to remember. Carbamazepine is approved for the treatment of bipolar disorder, belonging to the class of anticonvulsants. Carbamazepine is known to be a mood stabilizer that works in the brain. Bipolar disorder causes extreme mood swings that include emotional highs, known as mania or hypomania, and lows, known as depression. Symptoms of depression include feeling worthless, guilty, hopeless, helpless, and having a loss of interest in normal activities. On the other hand, symptoms of mania include feeling irritable and having an increased self-esteem. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. You can manage your mood swings and other symptoms by seeking help. Medication, psychotherapy, gaining more education about bipolar disorder, using self-management strategies, and having external support from family and friends are all great alternatives in treating bipolar disorder. Everyone will receive the best treatment fit for them. That concludes my presentation on bipolar disorder, and thank you so much for listening.